Well, investment is also much needed in Afghanistan's medical sector. While the country's healthcare system has improved over the past decade, critics say progress is slowing, along with waning foreign aid. Natalie Carney reports from Kabul.
Emergency hospital in the center of Kabul has never been busier. Daily, patients arrive from everywhere.
From Ghazni, from Tagab, from all the places around Kabul.
With every kind of war injury.
So he's coming from Bagram, 12 years old, and he arrived with a bullet injury to the abdomen, with a severe injury to the stomach, liver, spleen, kidney, pancreas, bowel.
Healthcare in Afghanistan has never been so critical. As the security situation deteriorates, more and more people are in need of dedicated trauma care. Yet state-run facilities struggle to supply even rudimentary health care as insecurity and limited resources challenge the system. Meanwhile, private clinics too are being closed down for providing substandard care. Other hospitals have also been targeted in the ongoing violence. 18-year-old Reza arrived a few hours ago, bleeding profusely from a bad stab wound in his right thigh. Doctors say it's a miracle he's alive.
Yeah, I'm hurt with knife. A person is attacking me and he's hurt me and I'm getting bad injuries.
In another ward, 14-year-old Ahmadullah, who was shot through the head in the volatile province of Ghazni, is getting his brain x-rayed in one of the only CT scan machines in the country. Run by an Italian NGO, Emergency have trauma hospitals in Kabul, Helmand and Panjshir provinces, with 44 smaller first aid posts in some of the most remote and dangerous pockets of the country. They offer high-quality care, free of charge, and with no questions asked. Here in Kabul alone, they conduct an average of 60 surgeries a week, unheard of in the rest of the world.
Emergency is a vital lifeline for the Afghan people and their communities. The majority of NGOs who work in this country must do so with substantial security. Yet here, they rely on the good work they do to protect them from being patients themselves.
Our security is our reputation itself. If you really are willing to provide a proper service, you are honest with your idea, you do not compromise what you are doing, things are coming themselves. Never give up on what you believe and what you are trying to do here. The people will understand.
While millions of donor dollars have been pumped in to help support Afghanistan's ailing healthcare system, an investigation found much of those dollars were being spent on facilities that don't even exist, making it increasingly more difficult to fund proper operations like Emergency. Just before leaving, a man was rushed into the operation room, shot in the neck. Family members say he was simply trying to break up a disagreement between neighbors. And just like its civilians, Afghanistan's healthcare system has become another victim of the country's decades of war. Natalie Carney for CCTV in Kabul, Afghanistan.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.